The PICO question guiding our evidence-based project is, among postoperative patients, what is the effect of wearing compression devices while awake in bed, in addition to anticoagulant therapy, on the prevention of DVTs in comparison to anticoagulant therapy alone?
5 Northwest is an orthopedic trauma floor dealing with a lot of patients who are bedridden or immobile following surgeries, leaving them at high risk for DVT development. DVT prevention is important for both nurses and patients. For nurses, it is important to assess and aid in the diagnosis to prevent DVTs and promote safety. For patients, it is important to decrease complications, in which will decrease the length of hospital stays postoperatively.
It is important to educate patients and healthcare workers on the signs and symptoms of a DVT, such as leg pain, red or discolored skin in the legs, edema, or feeling of warmth in affected legs. This is important because if these are not caught or prevented in the early stages of care, life-threatening scenarios such as a stroke, MI, or PE can occur if a clot becomes dislodged.
To find our articles with the help of the College of Nursing librarian, we access the University of Cincinnati Medical Library in the CINAHL database, using keywords such as deep vein thrombosis, prevention, postoperative, surgery, compression devices, anticoagulation, pharmacological prophylaxis, and DVT prevention, and the limitations of the article being within the past 7 years, peer-reviewed, in the English language, and full online text. We were able to find 5 articles that addressed our PICO question.
This Level 1 good quality article resulted in the finding that wool graduated compression stockings increased lower limb venous blood flow during prolonged seated immobility due to surgeries, thus aiding in the venous thromboembolism prophylaxis.
Article 2, which was the Level 1 randomized control trial, compared compression boots and low molecular weight heparin in the prevention of DVTs postoperatively. Results of the study were that there was a lower rate of DVTs in patients using low molecular weight heparin and compression boots versus patients just using the low molecular weight heparin. This proved that using the combination of compression boots and low molecular weight heparin reduced the patient's risk for developing a DVT.
Article 3, which is a Level 1 randomized control trial, compared the effectiveness of compression devices combined with anticoagulants for DVT prevention in total knee replacement patients. The results showed a lower amount of DVTs in patients that received both interventions. Researchers stated that this is the best approach for prevention of DVT in this patient population.
This Level 2 randomized clinical trial study's results concluded that the use of all graduated compression devices, no matter the pressure, prevented DVTs. The combined use of pharmacological, mechanical, and physical methods and patient education is effective in the prevention of postoperative deep vein thrombosis.
This Level 3 retrospective study assessed the value of using graduated compression stockings and concluded that there was no obvious benefit to decreasing the rate of venous thromboembolisms with the use of this intervention. Our recommendation is that every patient, unless contraindicated, be placed on anticoagulation therapy and compression devices postoperatively in order to significantly decrease their risk of developing a deep vein thrombosis. This is currently the practice that's implemented at 5 Northwest at UCMC. Following up on our recommendations of combined care, this will positively affect patients because they will always be the main priority when dealing with nursing care. These implementations will overall give them a better quality of life and decrease their length of hospital stays and complications that could occur from these DVTs.